Hey y'all, in this video, I want to share with you a treatment that we do in physical therapy called graded motor imagery and why this can help uh, patients or clients or people who have chronic and persistent pain, not just back pain, but pain anywhere in their body. So basically, our brains hold a map of our entire body. And the map is, we have a map of our hand, we have a map of our foot, and that's so that our brain and we're self-aware of where our body is in space. And what happens when we have chronic and persistent pain, or for example, we've been in a brace for a long period of time, or maybe had surgery and we've been immobilized, is the mapping of that body part on our brain starts to get blurred because we're not using it. And so the brain kind of has this use it or lose it mentality when we're not using that body part, or it feels a little distorted because of pain. It starts to be unclear. The map starts to get a little blurry or maybe distorted. I've had patients say, my right arm just doesn't feel like it's part of my body, or this hand feels smaller or bigger than the other hand. I know when my son got out of his boot from his surgery, he said he's like it doesn't feel like my foot is mine. So we did some of this work and graded motor imagery. There are a few things that we can do to improve the mapping in our brain. And what happens is when we can improve this mapping, it's like taking a lens and just making it that much sharper. And when our brain can perceive a body part with a very clear image, it doesn't detect threat. When it's blurry or it's bigger or smaller than the other, the brain doesn't really know what to do that information, and it detects some sort of threat that something is not right. And as we know from all the previous videos, is that when our nervous system is involved and our body doesn't feel safe, that there's a threat, then that can turn the volume up of the symptoms, whether it's pain, dizziness, IBS, anxiety. Those are all outputs of the nervous system. So one of the first things that we do when we look at this kind of cortical mapping, so to speak, is a technique called left-right discrimination. And it's also called laterality. It's basically where there's an app that we use. You can actually look at magazines and pictures of different, like if it's your hand, you want to look at just different pictures of people and just notice, is that their right hand or their left hand? Because when that mapping gets blurred, that left-right discrimination starts to decrease. The accuracy starts to go down, and it just takes a little bit longer for that kind of injured side or affected side to think if it's right or left. So that's the first one. The second one is kind of a graded exposure or visualization. And there's lots of studies about this that just looking at videos of someone doing something or imagining doing an activity can improve the cortical mapping in your brain. There's a study about uh, people who were pulling a coil with their finger, and they did it for about 10 minutes every day. I think it was for about 2 weeks. And then the other group, they had imagining pulling the coil. They didn't even have them pull their finger. They're basically just said, I want you to imagine pulling this coil as hard as you can for 10 minutes. And the group that didn't even do it but imagined it got about over 50% of the strength gains that the original group. So not as much as the original group, but I mean 60% is still pretty good. So by visualizing an activity in a positive way, if you attach a positive emotion to it, can really improve that cortical mapping, and also, in addition, decrease a bunch of fear. Because if we can, for example, if every time I run I get severe knee pain, I might want to start looking at pictures of people running, and then eventually looking at videos of people running, and then kind of the third phase is me imagining myself running, without pain. So not doing the actual activity, but imagining it or visualizing it. And the third, there's actually a fourth I'll talk about as well. The third is mirror therapy. So this is super effective. I use this a lot with shoulder patients and knee patients after total knee replacements, or just anyone with shoulder pain, because it's really easy to mimic that movement in the mirror. So I'll have a mirror on the side here. Let's say it's their affected arm is the right. I'll have them take the left arm and imagine they're lifting both arms, but you're really only looking at the mirror image of your uninvolved arm in the mirror. And what they're doing is they're just kind of like giving feedback to the brain to make it look like their right arm is lifting all the way up in a pain-free way. Another one I really like to do is localization. And this involves kind of drawing, maybe not physically on the body. I usually use the patient's phone and draw a grid. And then I'll touch certain areas of the affected, joint or limb with either the tip of a pen or a blunt, kind of eraser, like a more soft object, and I'll have them point to or label like which number I'm actually putting the contact in. So if it's like 1, 2, 3, 4, 5, 6, I might take a picture, do a grid with the patient on their phone and have them look at it without looking at their arm. And I'll have them let me know, okay, which box am I touching you in? And that also helps improve the cortical mapping. So I know sometimes this subject can get a little confusing, but once you understand how our brains have this kind of map of the entire body, because sometimes I'll give patients like the pictures, the left and right pictures to look at, and they're like, "Why are you having me look at pictures of the shoulder?" Right? And so I've done this with people, particularly who have been too sensitive to even try to work on. The fear and the pain is so high that I can't even get my hands on the patient to get it to calm down. So we'll do this left-right discrimination, and there are some apps that use it, or mirror therapy, or something to work on the mapping of the brain, and have gotten really, really great results.